Minister, Cappagh Hospital is a fantastic facility with the best of staff, nurses and surgeons. People who have availed of its services have nothing but praise. And the reality is that there has been an increase of 40% in patients, coupled with a reduction in funding from recent budgets, as well as cessation of the National Treatment Purchase Funding, the NTPF. This year, 2015, an increase, according to the Minister, has been promised in funding, which should allow for an increase in inpatient procedures. The opening of closed and underutilised facilities, which have been closed and are totally underutilised and not even, in some cases, hadn't been manned. That should result in additional theatres, in the region of something like the 4 theatres operating on a daily basis, and that's urgently needed. Recently, an orthopaedic surgeon told my colleague, Deputy O'Keelan, that the level of funding for the hospital has been nowhere near sufficient to look after persons in a timely way, and this lack of funding was preventing a person from having an urgent hip replacement, which they are in critical need of. In response to a question on this, Minister Varadkar said that the HSE has been engaging with Cappagh and trying to identify ways to cut waiting lists and increase resources. He said additional funds would be made available in 2015 in order to open an additional 1.5 theatres per day. I'd love to know what the progress on this, Minister, is. Have waiting lists shown a real decrease, and will we see a real decrease with this funding? At the end of January, there were 686 patients awaiting knee surgery, 100 of which have been waiting between 9 and 12 months, and a further 70 over a year. Some samples I have from my own area, and this is a myriad of people have been coming from across the country, but I'll just give you some samples. A constituent of mine who's 76-year-old, living with her husband, who has Parkinson's disease and dementia, and is waiting on a back operation for 2 years, and is down on the urgent list since March 18, 2014, and on the 5th of September last was brought in for a pre-op. This woman is confined to her home with the added problem of caring for her husband, who's reliant on her support. A second case I have is a 50-year-old man married with 3 children who has psoriatic arthritis, a chronic disease characterised by a form of inflammation of the skin and joints, which can cause inflammation of the spine as well as tendons, cartilage, eyes, lung lining, and rarely the aorta. He was referred to Cappagh Hospital from Blanchardstown in February 2014, 1 year ago. He got his tendons done in Blanchardstown over 18 months ago and needs his hands straightened and fused, which should have been done shortly after his tendons had been done. An assessment form was sent to him only a month ago, and still he has no indication of when this procedure would be carried out. His quality of life has been destroyed, as well as his ability to work or play even with his children. The third case I have here is another woman who is 79 years old, has been housebound because she needs a replacement knee, and is 3 years in total waiting with no quality of life. A recent parliamentary response I read on the 16th of December and sent to her family stating Cappagh Hospital has confirmed that the woman was referred to the matter and was placed on the inpatient waiting list for Cappagh Hospital on the 2nd of April. This means that she is currently 8 months on the inpatient waiting list. Only patients waiting 14 months or over are currently being treated. Cappagh Hospital further states that urgent patients continue to be prioritised, and Cappagh Hospital has advised that due to strict chronological booking policy, all patients attending the hospital are being offered dates for the waiting time for surgery, which due regard to clinical categorisation. Thank you.
Good morning, Minister.
I'd like to thank the Deputy for raising the issue, and I don't think it's unique to Cappagh Hospital or indeed to the Dublin area. I'm taking this reply on behalf of the Minister for Health, who unfortunately is out of the country. The Minister for Health briefed the House on Cappagh Hospital operating theatres in November last year. Cappagh National Orthopaedic Hospital is one of the major elective orthopaedic facilities in Ireland, providing a national, secondary and tertiary referral services for orthopaedic care for both adults and children. The Minister met with representatives from Cappagh Hospital late last year to discuss the issues faced by the hospital. as a result of the increase in the number of overall patient referrals, a reduced budget, cessation of NTPF funding and a reduction in private income, there was a reduction in the surgical capacity of the hospital. So while Cappagh Hospital has a total of 7 operating theatres, there was sufficient consultant staff available to provide services to meet demand requirements, but not all theatres were in use in 2014. In terms of staffing numbers at the hospital, it is of note that at the year-end 2014, overall staffing levels at Cappagh Hospital were not significantly less than they were in 2008. There were approximately 330 whole-time equivalents in 2014 compared to 328 whole-time equivalents in 2008. While the number of staffing whole-time equivalents fell slightly between 2008 and 2014 from approximately 124 to 123, the number of medical dental whole-time equivalents increased from 36 to approximately 43 and is currently at its highest level since 2008. However, in 2014, Cappagh Hospital experienced an unprecedented increase of approximately 40% in demand for its inpatient treatment, a level of increase that was not observed in other sites. I am happy to inform the Deputy that further funding of $800,000 was provided in late 2014, which allowed Cappagh Hospital to undertake additional workload. Furthermore, the HSE, through its 2015 budget allocation process, has also provided Cappagh Hospital with additional resources of $4 million from its 2014 allocation to allow for an increase in inpatient procedures. The 2015 budget allocation process has also made provision for the opening of closed and underutilised capacity at Cappagh Hospital. This will enable the opening of an additional 1.5 theatres per day, bringing the total number of theatres open to 4. This will allow Cappagh to increase activity levels and to significantly address its current waiting list and breach volumes. In 2015, the HSE will continue to engage with the hospital regarding their budget and to explore mechanisms to ensure optimal use of resources, including theatre capacity at the hospital within the overall resources available to the acute sector. The Deputy will also be aware that Cappagh Hospital is part of the Ireland East Hospital Group, which includes the Mater University Hospital, St Vincent's University Hospital, Midlands Regional Hospital, Mullingar, St Luke's General Hospital, Kilkenny, Wexford General Hospital, National Maternity Hospital, Our Lady's Hospital, Navan, St Columkills Hospital, St Michael's Hospital, Dunleera and the Royal Victoria Eye and Ear Hospital. I'm also confident that there will be a structured integration of Cappagh Hospital into the Ireland East Hospital Group in 2015, and this will provide opportunities and support for Cappagh Hospital in managing demand and delivering high-quality, safe patient care in a cost-effective manner. Again, I thank the Deputy.
And now calling Deputy Ellis for further supplementary.
Thank you, Minister. You know, Cappagh Hospital is not far from where I live, and it's been an iconic facility for so many years. And there's absolutely no doubt that there's urgent need to address these waiting lists and the understaffing as well. Because although you said that the staffing levels didn't change that much, there has been an increase of 40% in last year, which really, and this coming year, we also have a number of people retiring. So we are going to have to address both them. And I'm just hoping, Minister, that we do address both of these. It's good to hear that there's extra funding be put there. But the reality is, we've 4 theatres now going to be operating where there should be 7 operating. And that is a shame on us in many ways that we haven't got ourselves up to some capacity near that 7 theatres or close to it. That is why I have 79-year-old people waiting for hip replacements, for all sorts of different replacements. Many of them are very elderly and are waiting now 12 months. And we're talking, I don't know what this is going to cut the waiting list down to. I hope it's going to cut it down considerably. But we should be taking into account the age of some of these people as well. That this particular woman that I outlined earlier on can't even go outside the door. She has her husband who's dementia. She can't even walk. And she's told she may have to wait another 3 or 4 months. I think it's outrageous. I just think that there needs to be a humanity attached to the way things are judged. You put them on a list and you go tie them on list, but you don't take into account the fact that this is a very elderly woman with very external circumstances attached to her. So I really hope now that we can address this even more. But the nursing situation, from what I hear on the ground, is far more serious than you're maintaining, that the amount of staff needs to be addressed. And we also know that obviously we could do with more surgeons and we can do with more physicians and that.
Thank you.
But there is no indicator that we're going to see that down the road as well. Okay.
Minister, to conclude.
I'll be very brief. Deputy Ellis, there's no doubting that the circumstances that we find ourselves in as a country is not ideal. And I think that we are, and I know someone else got into trouble saying this, but I think that we have made significant progress, even in terms of additional revenue being put into the health service. And the things that happened shouldn't have happened. And the consequences of that was that we started to develop waiting lists like the lady you're talking about. And I am sure that when orthopaedic surgeons or any other surgeons, GPs or nurse managers take a look at someone's circumstances, it's not just the pain they concentrate on. I'm sure that they take all other issues into account. It is the intention of the Minister for Health and myself, because we have discussed it virtually on a weekly basis now, that the long waiters, the people that have been waiting more than 12 months, really need to be catered for. But I can tell you from my own area in Cork, and I have met a lot of surgeons down there who tell me that the circumstances are such now that by the time the surgeon gets to see them, for instance, if they get to see 8 new people per week, which is, with the return visits and the people needing to be managed and the theatre time and all the rest of it, that's a significant number. That 6 of them will be recommended for immediate surgery. So, there are issues around orthopaedics that we do need to challenge and we do need to concentrate on. The difficulty is, Deputy, as you and I know, that as soon as you get that area sorted out, there will be another area emerge. And, so it is always about the prioritisation. The additional money going to Cappagh this year will help. It will help. I have never been someone that says that consultant surgeons do not work hard enough. My own personal experience tells me that they work extraordinarily hard and long hours, and they're not people to shy away from work in the main. And I would have to tell you that with the extra theatres open and with the additional money, I would be very hopeful that you will see an improvement in the type of waiting times that the people that you represent experience.
That concludes